Assalamualaikum warahmatullahi wabarakatuh. This time, we'll explain my paper about evaluation of implementation of a COVID-19 medical waste management policy in healthcare facilities. As we know, the pandemic COVID-19 has an impact on the paralyzed economic activities, community social activities, and education activities, also environment. The increase in COVID-19 case has resulted in increasing COVID-19 waste and in healthcare facilities, individual, including masks, gloves, and other protective equipment being produced during this pandemic. All waste generated within the treatment facility should be considered as medical waste and should be collected and disposed with additional precaution and treatment. Several guidelines have been proposed, like proper management of municipal solid waste using protective equipment, manage COVID-19 contaminated waste as regulate medical waste, recycle waste using safety practice that prevent infection and cross-contamination, and post-waste treatment using ultraviolet irradiation for inactivation. Data from Ministry of Health in 2020 show the number of healthcare facilities which has processing facility license, waste collector or incinerator currently amount to 120 hospitals out of 2,000 hospitals, and only 5 hospitals have an autoclave. In fact, all provinces should have medical waste processing equipment in their area. In Central Java, a number of issues were discussed, including the processing of medical waste used for handling COVID-19. Many hospitals that has own incinerator or medical waste burning tool but cannot operate because it is constrained by permission of the Ministry of Environment and Forest. Therefore, it is important to evaluate the implementation of policies related to the management of COVID-19 medical waste in healthcare facilities. The method of this paper is using systematic literature review, using preferred reporting system for systematic review and meta-analysis, are commonly called PRISMA. This method is carried out systematically by following correct stage. It describes a successful review involving 3 main stages, like planning the review, conducting the review, and reporting the review. Search research database used to search the literature is through the news on the internet based on criteria related to the management COVID-19 waste in facilities of health service. The result of this paper is at the socialization stage for the management COVID-19 medical waste. The Ministry of Health has provided guidance to advanced level referral health facilities to manage their waste. In addition, healthcare facilities can also work together with third parties. At the socialization stage, the Ministry of Environment and Forest, in collaboration with Commission for Indonesian Parliament, carry out socialization of handling waste processing in healthcare facility in Kalimantan. In Bali, the Tabanan Regency, in collaboration with the Ministry of Environment and Forestry, with Commission 4 of the Indonesian Parliament, had a social session on handling of COVID-19 infectious waste. On this occasion, assistance was also handed over to many villages in Tabanan. In North Sumatra, the Environment Service and Health Office held socialization by presenting research from the North Sumatra Provincial Health Office, and the head of environmental dispute in this presentation explained healthcare facilities to have temporary storage place for hazardous and toxic waste. During the implementation phase, the management of medical waste from several hospitals and others that handle COVID-19 is in accordance with the procedure. From health facilities, it is collected and then taken to the waste treatment place. However, not all hospitals have incinerator that standard, so they must be collected in special container and sent to the waste treatment place. In the province of East Kalimantan, many areas that have not been granted aid in the form of supporting means of handling domestic waste. During the COVID-19, transportation of COVID-19 waste from quarantine facilities to hospitals that have incinerator is still carried out using Public Service Operational Vehicle or ABV. Because and the hospital do not have the incinerator operating permit. It happened the regional government in West Java, through PT Java Medifest, has increased its waste handling capacity. This was done as an effort to anticipate the surge in medical waste related to COVID-19 pandemic in West Java. The management capacity of Medifest has been increased to support management and countermeasures from upstream to downstream. In addition, other provinces that request assistance for waste to be processed can also be assessed in here. In Lampung, that has also collaborated with third parties to manage COVID-19 infectious waste. Each puskesmas will send COVID-19 medical waste to Abdul Muluk Hospital, then it will be transported by PT Biotechnika Prima, transport to be destroyed by PT Wastek. In the Mentawai Island, the handling of infectious waste at Muara Siberut Health Center and the Siberut Pratama Hospital, which is the isolation place for COVID-19 patients, is accordance with technical instruction according to letter Minister of Environment and Forest number 2, 2020. The Siberut Primary Hospital is still under construction and its operational supervision is still under the Siberut Health Center, especially when treating COVID-19 patients. Although the Sibur Pratham Hospital does not yet have the incinerator equipment as contained in the letter of Minister of Environment and Forest waste from the treatment of COVID-19 patients such as hazmat and other equipment used to treat patients is destroyed in the special area. In Central Java, the problem that arises is that domestic COVID-19 medical waste storage has not been packaged in airtight box which will later be transported by third party. In addition, the incinerator is currently in a stage of disrepair to function as COVID-19 medical waste management tool. Medical waste COVID-19 at the healthcare facility in Solo, Central Java trouble with shelter. This is because the temporary shelter for medical waste in healthcare facility is full quickly. In addition to Solo, number plastic waste to medical waste pedestrian Simpang 7 Kudus area, Central Java, the also antigen test disposed of carelessly. So from this paper can conclude that regarding the socialization of COVID-19 waste management in some area, it has been running according to regulation. However, various obstacles were encountered when implementing waste management, including not all healthcare facilities have incinerator. Some already have incinerator but do not yet have operational permit. In addition, the lack of waste storage and the difficulty of transportation from healthcare facilities in collaboration with third party to the company as place of management are also problem in several healthcare facilities. Problems related to the management of COVID-19 waste can be given solution by adding temporary shelter at healthcare facilities and adding incinerator. In addition, waste transportation in some areas also needs to be considered. Okay, thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.